Hello, my name is Regine Roland, and I will be discussing health disparities and inequities. A health inequity is the implication of equal or fair opportunity to attain full health potential with no disadvantages or obstacles. Everyone should have a fair possibility to live a healthy life. Equality does not mean the same thing as equity. Equality would be to give everyone an equal opportunity to try to reach the same goals. Equity is to give those who are more disadvantaged more opportunity to reach the same goals that others are reaching. What are health disparities? The CDC defines health disparities as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. In other words, health disparities are the measurable differences in individuality, biology, and environmental factors that affect one's access to primal health or healthcare. Determinants of health assist with very many health disparities. The range of behavioral, biological, and socioeconomic factors influence the health status of individuals or populations is what determinants of health are. Determinants of health are the root causes of health disparities. Some health disparities are prominent in the United States include low quality education, non-nutritious food, unsafe housing, unaffordable public transportation, no access to health insurance, and polluted air or unsafe drinking water. The different disparities that exist in California. There are many different health disparities that exist in California, and there are also very many reasons. California is one of the most diverse states in the United States of America, causing our population to be faced with many inequalities and many differences that are caused socially, economically, and environmentally. The many inequalities that Californians face create gaps in healthcare and health for many. Immigrants are a huge group in California that do not receive primal health or healthcare. California has very many documented and undocumented groups who do not receive healthcare or health insurance to help pay for their healthcare. Many immigrants are also affected by lower education status and do not speak English, which creates a gap in pay between naturally born Americans and immigrants. With this wage gap, it is often very hard to pay for basic medical needs for children, family members, or women who have just had babies. Socioeconomic status has a big effect on healthcare received. The more one pays towards healthcare, the better healthcare they will receive. Without a stable or acceptable job that is defined by insurance companies, good healthcare is an unattainable goal for many Americans and Californians. In California, about 13% of the population is considered to be in poverty. This part of the population does not receive acceptable healthcare. Geographical location is also a very big determinant of health. Many people who live in cities that are lower income often contract more diseases than those who are in higher status neighborhoods. In California, the cities that are lower performing have tendencies to have factories and more pollution in the air. With more pollution, the health of the citizens are more at risk. And there is also less access to nearby healthcare institutions in the cities that are more run down. In conclusion, there are many different health disparities that everyone around the world face, causing unhealthy lifestyles. These health disparities are usually caused by a lack of access of care and a lack of quality of care. All people deserve to reach health equity and can do so with various programs. Here's a picture from the CDC explaining how to reach for health equity. It shows a bigger man who is able to reach for the best health possible. And there's also a smaller man who's trying to reach for the best health possible. Without the programs that are designed to reduce health disparities, the smaller man would not be able to reach health equity. So this basically just proves that we need programs to help us provide health equity for all.